Hello, everyone, and thank you, Ruth. And yes, as Ruth mentioned, I'm a politician, but I'm also a harm reductionist. I I use a seatbelt. I try and stick to the speed limit. I wear sunscreen. I use contraception, and I vape. And as Ruth mentioned, I'm a member of Parliament in Australia, in Victoria, and in the very fine city of Melbourne. So I represent the very fine folk who are just coming out of an extremely long lockdown, and I send my condolences to you in the UK who are just about to go back into one. We're just right now feeling a very little bit of a very welcome taste of freedom here. Um, as Ruth mentioned, I lead a party called the Reason Party, a political party, and we used to be called the Sex Party. But and we had a tagline that said, "We're serious about sex." Well, we are still serious about sex, but we're also serious about reason and evidence. So I was asked to start this, to open this discussion with the question, who should politicians listen to when developing policy? Well, really, I could end this talk right now and say David Nutt. Professor Nutt really is who we should be listening to, and it is those experts. But who should politicians be listening to? It's a very good question, but I kind of feel right now it might not be the right one. I mean, I'm passionate about reducing harm, and I'm passionate about reducing the harm that politicians do. And right now, that just feels difficult. You know, as I mentioned, I've been in lockdown and sort of reflecting on this and reflecting on the year that has been 2020. And while I've been reflecting and largely at home, I've been dealing with conspiracy theorists, populist policy, a refusal to accept science. And I'm sure many of you here have been doing the same. I mean, this virus has shown us how fickle politicians can be about evidence, science, and medical advice. I mean, I've found that politicians in my country, and I know and obviously internationally, are finding it very hard or convenient to ignore the science, ignore the evidence, and ignore the medical advice when it comes to COVID. I mean, on the flip side, and I think Victoria is an example of this, and some parts of Australia are examples of this. We have listened to the science, and we have listened to the experts. So maybe this does provide us with an opportunity to have these conversations around tobacco harm reduction, or maybe even things like the existential threat of climate change. But so many of our politicians have argued passionately to ignore the advice of public health organisations, to ignore the advice of the experts, to ignore the advice of the World Health Organization. These are the same organisations that they passionately follow and quote from when it comes to tobacco harm reduction. Now, in a way, you know, we already practice tobacco harm reduction in Australia, and our politicians promote it. We just don't call it that. I mean, we restrict where tobacco can be sold and where it can be used. We control who can buy it and how much it'll cost, but we don't prohibit it. But for some reason, regulating non-tobacco nicotine products is just going too far. We continue in Australia to prohibit these products and resign and relegate them to grey and international markets that we have no control of. So when politicians debate tobacco harm reduction products and whether they should be available to adults, they rely, I think, on three arguments for maintaining the prohibition on these safer nicotine devices and products. They say, we don't know the harms. We're worried that children will use these products, and big tobacco's involved. Now, you know, apart from putting aside the obvious, the obvious absolute harms that tobacco causes our society. And Professor Nutt spoke about that very eloquently. If you wanted to develop policies that reduce the harm of other nicotine devices, such as vaping or heat-not-burn products, you would regulate and control what could be sold and how it could be sold. If you wanted to ensure that young people didn't access these products, you would regulate where such products could be sold and who they could be sold to. And you wouldn't consult with big tobacco about products that will reduce their sales, nor would you take donations from them. And I'll talk about that in a minute. So if we go back to the question, who should politicians listen to when developing policy? Obviously, the answer is simple. The politicians should listen to the evidence, listen to the experts. And this is the conundrum, because on the face of it, they do. You know, in 2016, when the Parliament was first debating this subject, the politicians quoted expert after expert, the Cancer Council, the Heart Foundation, the Australian Medical Association, the World Health Organisation, the Asthma Foundation, the Heart Foundation, the Stroke Foundation, the Dental Association. The list went on and on. So why are we still coming down against vaping? And why are they coming down against vaping? And I think David probably touched on this, and it's certainly something that I think is extremely important. But maybe they were being asked the wrong questions. As I said, I think in Australia we already practice some forms of tobacco harm reduction, but we just don't call it that. So when we're developing policy on tobacco or alcohol or even illicit substances, we ask, how can we reduce harm? When we're developing policy on alternative nicotine products, we ask, is it safe? When we're developing road policy, we ask, how can we reduce death? Not, is it safe? So the experts are being listened to, but the policy question they're answering is probably not right. We're not asking, how can we reduce harm? How can we prevent children from accessing these products? But when I asked the Victorian Health Minister who she consulted with in developing the new policy on, as she called it, e-cigarettes, she said she was advised that they had consulted with representatives from large and small retailers, local governments, unions, public health bodies, the hospitality industry and various government agencies. Now, those large retailers that they consulted with were Coles and Woolworths, the largest retailers of tobacco in Australia, who also provide millions of dollars in funding to the Cancer Councils each year. Now, the Cancer Council would or will be outraged at the suggestions that they would link their policy positions because of the donations that they receive money from. So to say that in another way, I mean, I think Cancer Council would be outraged for me to say, you receive money, you receive significant donations every year from the biggest retailers of tobacco, and you've got a policy to maintain tobacco sales and not look at safer alternatives to tobacco. Now, they would be outraged about that, but they accuse us of the same thing. They accuse us of being in the pocket of big tobacco, so they can't have it both ways. And many of the groups that they work with have worked up a kind of a story and a mindset about what constitutes damaging behaviour, and they can't admit anything else. It's like politicians cannot bring themselves to see cannabis in another light, for example. And frankly, these politicians and our institutions just don't like new things. The experts keep telling us there's insufficient evidence. The Cancer Council constantly tells our politicians in Australia that given the potential risks, they suggest extreme caution. They recommend that these products, these safer nicotine products, be prohibited from sale. 1 in 8 people who have cancer in Australia have it because of smoking. 19,000 people die every year from smoking-related diseases. Shouldn't we do everything we can to help reduce the harm that smokers are subject to because they're addicted to nicotine? So in thinking about, again, politicians should be listening to. Now, I don't know if many of you heard, but our federal health minister announced a few months ago that they were going to completely ban the import of nicotine, liquid nicotine for vaping devices, that it would be completely banned unless you had a doctor's prescription. And not only that, the doctor would have to import it for you and have it sent to a chemist where you might be able to buy it. Frankly, the chemists in Australia were not that excited about providing nicotine for vaping devices. But interestingly, that was sort of cut off at the side by these sort of, well, I shouldn't call them mad, but these conspiracy-wielding, Trump-loving politicians who kind of raised their arms on this, and they were from the same side of politics. So the health minister said, all right, we'll run a small inquiry to appease these guys. So, I mean, maybe evidence isn't everything, because these guys certainly don't support evidence, or they certainly support an alternate version of facts. But seriously, I think where politicians need to listen is to people with lived experience. You know, if they listen to their constituents, and I know I do. So if one health organisation says there's not enough evidence, we need to keep these banned, and yet that same politician receives 20 emails from voters telling them how these products help them, how these products save their lives. So to be completely honest, I'm not sure I know the answer of who they should be listening to. It should be the experts. But what the experts are telling us, as Professor Nutt was saying as well, what the experts are saying is probably as I say, what the experts are talking about is probably not the question they should be asked. It's about how do you reduce harm, not are these products safe? And I think that's where we need to change the question here. So I think it'll be really interesting to be involved in this panel. Thank you for the work. Again, burning issues, fantastic work. Thank you to all of the team that have put this on. I'm really looking forward to getting my nose into the new publication. The work that has been done, the publications that have been brought out do help, but we do need to change. We do need to change the minds of a lot of those so-called experts in this area. And I think that's working, that's happening. We are seeing it start to change. I just wish it would happen quicker in Australia. Thank you.